Welcome to YARKUD International. Let's start our today's Saudi Prometric exam question discussion. Let's see one by one. First question, a client is receiving mechanical ventilation when the alarm sounds and displays an alert showing low tidal volumes. All connection and the ET tube are checked and secure, but the alarm persistence while O2 saturation continues to drop. Which of the following is the most appropriate initial action? Okay, so here we have the situation. There is the alarming of the ventilated machine. Okay, and there is showing low tidal volume and the saturation is constantly, it is dropping. Okay, so what will be you do? So options: increase oxygen delivery to 100%, manually ventilate through the endotracheal tube, call the respiration therapist to assess the patient, elevate the head of the bed and apply non-rebreather mask. Okay, what you will do? So there is a tubing already connected. There will be 100% oxygen already going, but not effective. So we should not need to increase oxygen delivery 100%. Okay, already ventilated machine supplying only. But still there is a alarming and O2 saturation dropping. And manual ventilation through the endotracheal tube. That we can give. Okay. So when you just call the respiratory therapist, assess the patient, by the time the O2 saturation will be dropped very low. Okay. And the O2 supply will be very less to the body. And there is elevate the head of the bed and apply non-rebreather mask. It will be delivered not full amount of oxygen. So what will be the best one? Manually, we have to ventilate through the endotracheal. Directly, we are giving the oxygen. Okay. So ventilate the through the endotracheal tube. Okay, so that will be the option here. So answer is B. Got the point? So you have to be read carefully because there is a tubing already secured. So increase oxygen delivery to 100% also not work out. So you have to manually give. Something is connected to the ventilated machine, some problem. So till the respiratory therapist come, you have to be do the manual ventilate through the endotracheal tube. Okay. Let's see the next one. A 67 years old patient was brought to the emergency room with history of diabetic mellitus, hypertension, heart failure, complaining of the acute shortness of breath and productive cough. The sputum was pink and frothy. During the assessment, the nurse noticed crackle and wheezes. Blood pressure is 80 by 45. MFHE, heart rate is 124 and the respiration is 36. Temperature is 36.5. Which of the following disorder should the nurse suspect? Okay, this is the question. So here the patient with the diabetic, hypertension, heart failure. Suddenly there is a complaint of acute shortness of breath. Okay, so acute means it is a sudden one onset. Okay, so here you have to be remembered. It is about the pulmonary because there is a shortness of breath is there, crackles and wheeze is there. Okay, and you have to see here pneumothorax, unstable angina, pulmonary edema, pulmonary embolism. Okay, so these are the things. So you have to check for the here the pulmonary complication 3 is there, pneumothorax is there, pulmonary edema is there, pulmonary embolism is there. Okay, so which one you will choose? Okay, so here you have to be select the options of signs and symptom as a priority. Okay, so here there is a shortness of breath. Shortness of breath can be come under the, so we will just take the unstable angina because there is no chest pain. Okay, so other A, C, D, three options are there. So if you take the shortness of breath, there can be three pneumothorax, pulmonary edema, pulmonary embolism will have the shortness of breath. Okay, and second one, productive coughing. And there is a key point called sputum was pink and frothy. Sudden shortness of breath and pink and frothy sputum seen in which patient? Okay, so usually this is called pulmonary edema patient will be having the pink and frothy sputum. Okay, and there is a BP low also, heart rate. It will be increasing respiration and heart rate. Okay, so this will be the main point you have to notice. Okay, so if you see the pulmonary embolism, there is a irregular heartbeat will be there, and there is will be the patient will be very sweating, very feeling anxiety, dizzy and fainting will be there for the pulmonary embolism. When you just look at the pulmonary edema, it is specifically, okay, so tension pneumothorax and all, that is a tracheal deviation. That is a key point. Okay, signs and symptoms. So here the key point, pulmonary edema will be the pink and frothy sputum. Got the point? So like that will be difficult to select, but you have to be pick the key point here. Okay. So let's see the next one. A nurse is inserting the nasogastric tube for a 65 years old patient with paralytic ileus. Immediately after incision, 200 ml of milky appearance drainage was noted in the back. The nurse is not sure if the distal end of the tube is in the stomach. What is the most appropriate technique? Confirm positioning. Okay. So to confirm the end tube positioning, what is the appropriate technique they are asking? Okay. So here the options: X-ray of stomach, check pH of drainage, aspirate more fluid and check if color change, flush with 100 ml saline and auscultate over stomach. So which one will be the test? Okay. Usually we will be checking the drainage of pH for the patient. Yes, we will be auscultate and see, we will be aspirate the fluid and see, we will do the X-ray also. But they are asking technique will be confirm the positioning. So you have to be this and all before the feeding, we will do the checks. Okay. But that is aspirating and auscultating and all before the feeding, we will just check and give the feeding. But to confirm what is the technique we will use, it will be X-ray of stomach. Okay, don't forget, it is not about pH checking, not about the auscultation, okay, and not about the aspirating. It will be confirmation question. It will be X-ray of stomach. Got the point? Okay, let's see the next one. A 47-year patient received spinal anesthesia 5 hours ago in the operation theater and was transferred to the surgical unit. Few hours later, the patient complains of incisional pain. The surgical side is dry and intact, but the patient looked pale and irritated. BP is 175 and 90, heart rate 112, respiration 27, temperature 37.6. What is the most appropriate nursing intervention you will do? Okay, here you have to remember the key point, nursing intervention they are asking. Okay, when they commonly ask, okay, first question if you see, commonly they just ask following the most appropriate initial accent. So we can just write it manual ventilation through the endotracheal tube. But here when they asking about the nursing intervention, what will be the nurse do, you have to select. Okay, got the point? Okay, here take a 12 lead ECG. Is that needed? 12 lead ECG. There is any chest pain, any shortness of breath? No, no need to take that. Okay, so no palpitation, no. So we will just cut off the A option. And the second one, administer pain medication. This can be done because there is a pain mentioned. Okay, incisional pain. So maybe it will be the option. Okay, keep it. So next one, notify the treating physician. Okay, that also can come. Okay, the D option, start IV infusion and place the patient supine. Okay, is that needed? IV infusion. There is BP 175 90 already. There is no need for the low. If it is lower BP, we will be giving the blood pressure low. We will just infuse the IV infusion. Here, no need. Okay. So D also not come. So it is B or C you have to find out. Okay. I have told you already what is the most appropriate nursing intervention. So without the order, you cannot administer the pain medication. Okay. So if it is follow the doctor's order, also not there. Administer pain medication. No, you cannot decide. Already there is a no oozing or anything, dry only the surgical side, and it is intact, but the patient is pale and irritated also. Is there not only pain? The patient looks pale and irritated. So what you can do, you have to notify the treating physician, because if the patient just received the spinal anesthesia 5 hours ago only. Okay, so notify the treating physician, it is the correct answer. Got the point? So you always think, because Sometime what we will do, there is a pain. So administer pain medication will be the answer. No, you cannot administer pain medication without the doctor order. Okay, what is the nursing intervention? Surgical. After the surgical, always remember we cannot do anything. We have to be informed the doctor. Okay, after the surgery. Okay, so notify the treating physician is the answer. Got the point? Let's see the last question. A 40 years old man was admitted to the male medical department with pneumonia. A nurse in the department explained and obtained the informed consent for the chest CT scan procedure with the contrast. Which of the following ethical principle is underpinning informed consent? Okay, here they are asking what ethical principle here applied. Okay, so what will be the thing? Informed consent. We are informing the patient we are going to do the chest CT with the contrast. Okay, so what will come under that? It is autonomy of the patient. Okay, patient has the own rights to take their treatment plan. Okay, included in the treatment plan. They are accepting. Okay, we are informing this has to be going to done for you. Yes, patient is accepting and signing. So it is called autonomy. We are informing to the patient. Okay. So it is called autonomy. So answer is autonomy. Okay. In the further video, we'll see the more question and answer for the Saudi Prometric exams. Here, the YARKUD International. We are giving online training for Prometric, SMP, MOH, DHA, HAD, OET, and IELTS, Oman Pearson View Nursing Examination.